Hi, I'm Emma. I'm one of the lead practitioners at I Need Therapy, a private practice based in South London, currently online via Zoom because of the pandemic. I'm an integrative counsellor and psychotherapist. I work with clients primarily who have suffered some kind of trauma in their lives, whether big or small. I specialise in gendered violence, miscarriage, rape, domestic violence, but also work along with clients when they have, anxiety, depression, and some of the other kind of life issues that come along with day-to-day life. The way I explain the way I work to my clients when I'm explaining to them how integrative therapy works, I kind of first explain on a holistic basis where I'm working with them to integrate how they feel, how they think, how they behave, some of their beliefs, so that they're more coming from a more wholesome and authentic place and understanding themselves better. And via doing this, I use two or more modalities of theory, which when combined can actually have a greater effect than using just one modality alone. So the way I work, I was primarily trained. I have a big problem with saying the word primarily, trained in the person-centered approach. However, when I was training, my placement was at an agency that specialised in gendered violence, sexual exploitation, domestic violence, rape, and they really worked along a trauma-informed, somatic type of therapy, which was in empowering the women we were working with. So I did, after my training, go on to do specialised training with Babette Rothschild. So I combine my person-centered therapy, where trauma is involved, with a somatic way of working. So that's working with the clients and their body and sensations and how they feel emotions or hold emotions in their body, and working with them in, experiencing those emotions, working with those emotions, understanding those emotions and how they work within their body, sometimes using breathing techniques, dance, movement, sensations throughout their bodies. I also work with a bit of transactional analysis because I also find understanding some of their interactions, the client's interactions with other people or with me within our relationship. We start to practice all the elements of transactional analysis so that they better understand their interactions in the wider world with people and who they are, and feel more grounded in what perspective they're coming from when they're interacting with other people, and are able to bring themselves more into their adult selves in interactions. So I do a lot with them with that. I also do a little bit of CBT when needed, in the sense of some clients like to have homework and like to have exercises that they can work with. So in my integration, I work according to the client's needs, using the tools I have to help them reach a place of authenticity, wholeness, and understanding who they are as people, and working with them really to resolve their traumas or work through their anxiety or depression or whatever it is they feel that they're bringing to therapy from session to session, or overall working with them with these various techniques and modalities to really get an understanding and to teach them some of the basis of the theory behind it as well, so that they too understand where their thinking, their behavior, their feelings, and how it's grounded in some of the theories that I've been trained in, so that they come away with an educational understanding as well. Well, I hope that's helped. Obviously, there are many ways of working integratively, and I look forward to hearing how other people work too.